Hello, I'm Dr. Diana Chafkin here at SCRC Fertility in Beverly Hills. I'm here with my amazing colleague, Carolyn Alexander, joining me. Is she here? Okay, good. So, I'm so happy you guys are here. I mean, I think we're going to open this up pretty quickly to questions because I think the most important thing is I want everyone to kind of be engaged and make sure you get whatever questions you have answered. I just wanted to kind of introduce some ideas, some thoughts here. Summer is coming, or summer is here practically, and it's a very exciting time. There are sort of some things that come up in the summer. So sometimes people start going on, fad diets or start potentially picking up their exercise routine. And I think diet, nutrition, exercise is so incredibly important. But one thing to kind of keep in mind is that over-exercise and sometimes under-nutrition can really affect our fertility. So we know that the menstrual cycle is very much dependent on our overall health functioning well. So we need adequate nutrition, adequate health for our brain's hormones to be secreted in a normal, healthy, functional way, and for those hormones to then basically secrete hormones to stimulate the ovaries to function well, and then for the ovaries to function well, for the hormones to be produced appropriately, and that all depends on a healthy, well-balanced diet. Exercise is important, but too much exercise can cause the body's nutrition stores to be depleted and therefore affect the brain from secreting the appropriate hormones, and that has a complete effect on the overall menstrual cycle. I always like to say the menstrual cycle, as women, we're very lucky that we have this thing that kind of happens in our body, which is essentially a barometer for our overall health. So if we're, undernourished with potentially less nutrition than we should have, then that can affect our menstrual cycle. We can see it pretty quickly. And so, and I think here's Dr. Alexander. Hello.
Dr. Chafkin.
Hello. So I was just kind of introducing kind of the IG Live today, and I'd mentioned definitely open for discussion, questions, wanted to kind of make this informal and just give this a time for people, during their lunch hour to be able to ask whatever questions they want. We started talking a little bit about diet and exercise, and I was just kind of talking about how diet and exercise are so incredibly important, but we have to be careful about not overdoing exercise and making sure that we have a well-balanced diet so that our overall fertility health can flourish.
It's so important. Yeah, that's so wonderful. I know you exercise a lot. You inspire me to get out there and get some cardio on.
Oh, you're so sweet. Yeah, it's so important. I love to run. I think it's so important. But yeah, we have to be careful about not overdoing it.
Definitely. So I'd love to hear your thoughts on like egg freezing and how to prepare ourselves. I wish I had some eggs frozen, so I think it's always helpful when we're helping patients along the way to think about the journey and what to expect and what to do.
Totally, absolutely. So funny you say that because I also had wished that I'd frozen my eggs too. I think both of us had kind of had some fertility issues personally. And a number of years ago when I started going through my fertility journey, when I started out, I was kind of kicking myself. Why didn't I freeze my eggs? Why didn't I do this? I mean, to my credit a little bit, when it was really, potentially an option for me, it was still experimental, right? I think in both of our careers, it became non-experimental kind of as we were already practicing. But yeah, it would have made the journey easier, right? So, the idea is that women are born with all of the eggs they'll ever have. And as we get older, we lose those eggs through a natural process of cell loss. So we lose eggs in number and eggs in quality. And we know that at any given point, we have the most eggs and the best quality eggs compared to any point in time in the future. So if we're in a situation where we think we want to potentially have a child in the future and we're not ready now, to freeze eggs is definitely something to think about. I'm sure this happens to you, Dr. Alexander, but probably you've had the situation where people will come to you and say, what's my egg supply? Should I freeze my eggs? Shouldn't I freeze my eggs? Am I a good candidate? And I often tell people, well, if you're a woman who is interested in potentially having a child in the future and you're not ready now, you're a candidate, right? I mean, obviously the extremes of age, right? Barring that, but as long as a woman, is generally menstruating, and we know that she, has some eggs, she's theoretically a candidate, because egg supply will only go down, egg quality will only go down, and AMH, right? So even if a woman comes to me and her AMH is really good, I don't say, oh, great, you have, lots of time, don't worry about it. Oftentimes I'll say, well, great, that means you'll probably respond really well. Why don't we capitalize on that and get your good eggs now, right? Keep them frozen. If AMH is maybe lower than we'd expect for a given woman's age, then I say, okay, right, maybe we're not in an amazing place, and maybe in a given cycle, you may not get, as many eggs as you would have wanted, but things aren't going to get better, right? And so let's capitalize on what you have now. Let's do an egg freezing cycle now. And maybe after that cycle, we'll talk about potentially doing another egg freezing cycle, maybe to get more eggs if that's wanted or desired. But I think there's no, in my opinion, there's no real kind of AMH or follicle count where I would say, oh, you don't need to freeze your eggs. You just use that information more to help me determine a starting dose, or also to give people an idea of what their prognosis is and how many eggs they might get in a given cycle.
Yeah, I think that's so important. I think it's fascinating too, because I'm really good friends with a British fertility doctor, and she, funny thing, looks like me, and we're similar age. But she says there, after 10 years, they sometimes discard the eggs. But we've had babies here from eggs frozen 14 years ago, and we help people carry the pregnancy if they want to into an upper age, and that can be as long as you're healthy and your pap smear, mammogram, your annual physical, you don't have high blood pressure or uncontrolled high blood pressure or health issues, then we kind of keep an open door to think through on your fertility journey. And so we've noticed that in the past, when we were really afraid that the eggs over time, that the mitotic spindle would be injured from the freezing or vitrification, it turned out that after, at least for now, at the 14-year mark for our facility, we've had healthy full-term babies, and we've been so excited about it because I think it's a like a wonderful opportunity to think through your future and what your goals are personally.
Absolutely. No, it's amazing. And yeah, it's worth reiterating, because people sometimes are surprised by this, but their chance of pregnancy really hinges on the age at which the egg was frozen, right? So if somebody freezes their eggs in their early 30s, their chance is pretty good of conceiving, even if they were to use those eggs in their late 30s, early 40s, which is, I mean, as you said, of course, the overall health of the woman is important. Her pap smear, her mammogram, and all of those things, right, are important to consider as a woman ages. But the age of the uterus itself isn't so much the thing that the pregnancy success hinges on. It hinges on the age of the egg, because in the egg is where the chromosomes are and the ability to fertilize and result in a healthy embryo. So it's amazing where we're at in our field. And yeah, and the fact that, yes, that we have these pregnancies 14 years after eggs have been frozen is just so wonderful.
And we work closely with our embryology team here at SCRC, and Diana and I are meeting and really, I think, kind of constantly staying at the forefront of medicine. And congratulations, she's the vice chair of the Women's Council for the American Society of Reproductive Medicine. I'm so proud of you, Dr. Chapkin.
Thank you. No, very, very exciting. Yeah, absolutely.
Women supporting women, and that's so exciting. I love ASRM, and I'm grateful to them. I know they are encouraging awareness of infertility, as all of us are educating and really empowering people to understand. I think a lot of people need to understand our fertility. So
absolutely, so important. And then, sorry, just to kind of going all full circle here, but we started kind of talking about exercise, and just to take it back to kind of like the egg freezing journey, just wanted to mention, exercise is so incredibly important, and like you said, aerobic activity, and I'm a runner, and when I went through my IVF cycles, I have to say one of the hardest things I was told was that you can't run, you can't do aerobic activity, and to understand the main issue here is that we don't want the ovaries to twist, and as a runner, that was a little bit tricky for me. But what I often tell people is that it's not about your heart or your lungs being able to withstand the physical exertion, right? Like you can walk, you can hike, you can walk upstairs, but we don't want those ovaries jostling. So just kind of a precaution. Health is important and exercise absolutely important. We don't want to overdo it because we want the menstrual cycle to still maintain function, but we have to if we're going to do an egg freezing cycle, you can physically exert yourself, just don't overdo it, and we want to be careful about the ovaries kind of jostling around. And yeah, any questions? Happy to kind of talk about really anything. You can ask us anything.
On my other IG live, I was letting people know on my site to come to this site. There was one question just about different supplements, and I always am constantly trying to get a sense on some of the supplements. I think I'd love to hear your thoughts too, Dr. Chavkin.
Yeah, so I think, supplements are great. To be honest with you, I think the most important thing is nutrition and diet. And I think that it's also not sort of like a last minute thing that you can just like quickly, take some vitamin supplements or change your diet quickly and then all of a sudden see life changing or anything really of significance, of substance in any given treatment cycle. I think, there's actually lots of good data to show that organic fruits and vegetables are so incredibly important, organic as opposed to the not organic, right? Because there's lots of toxins in our soil and our fruits and vegetables, and so I think need to be careful about that. So I think nutrition is incredibly important, but I think we have to understand that like our bodies are actually meant to absorb nutrients and vitamins through food, and I really don't think that should be really underestimated. I often talk to my patients about what they're eating, how they're eating, and I have a very low threshold for referring to a nutritionist, so people can go over their diet and what they're eating with their nutritionist. But I usually say like less packaged foods, less processed foods, lots of fresh fruits and vegetables. Protein obviously is really good, complex carbohydrates. And yeah, somebody's asking, right, as far as nutrition, what's the best advice? I mean, I think I really do think it's worth, like, for all of us, whether we're doing new fertility or not, to check in with a nutritionist and talk about what our diets are, what we're eating, how we're eating it, because it's important for our overall health, and that spills over for sure into our fertility. So I would maybe like even start there. I actually spoke with this awesome nutritionist the other day, and she was telling me one of the best advice she gives people is to slow down and chew their food. And I thought for a second, I was like, I always think of myself as such a healthy person, right? I run, I exercise, I eat healthy, but it's like, do I actually chew my food as much as I should? Probably not, And when you think about absorbing food and nutrients and food, like your body's not going to absorb the nutrients if it's not well digested. And digestion, it starts right with chewing. It's just something so simple. Yeah. So I think really
I learned. Yeah, from the nutritionist, I learned to be a little more conscious of fullness, because I think, like, for me, the sense of fullness is different than maybe some people. So I don't know if that's been kind of my struggle in a sense, but I never would have really tuned into that if I hadn't talked to the nutritionist. And right when I was trying to get pregnant, that 6 months ahead, I was like, let me focus on what can I do in my busy day to kind of small changes that can make a big impact too. And I tell the young, especially sometimes we'll see young PCOS patients who feel like a little frustrated because they're exercising and they're eating right, and they feel like, why is their body like changing, or their
really hard to lose weight,
apple-shaped body is occurring. And so I think what I tell them is that nutrition's over the 7 days. It's okay if you have a Friday night fun night with your friends. It's not like the end of the world. It's that it's over the whole week, what you try to do as a conscious effort. Um, I think what's interesting with organic is that I think everything in moderation, because sometimes there's good and bad things with everything we do. So everything in moderation, because some people can't just get all organic kind of
Well,
food.
right, of course, right, can be expensive too, right?
Yeah. And
And
then
I think also,
grapes and strawberries have the most pesticides. So those ones are the ones that may need to be considered to be organic in a sense. But
it's tricky too because we also say, antioxidants are so incredibly important, right? And where do you get antioxidants in food, right? From green leafy vegetables, from different colored berries, and sometimes that has pesticides in it. So it is kind of a balance, but I do think, when we talk about antioxidants, I do try to encourage my patients. I mean, if they want to take CoQ10, like, I think that's okay, but I do encourage people to eat fresh fruits and vegetables, and sorry, and especially fresh berries, of different colors, because antioxidants are just so rich in multicolored berries. So I think it's important. And somebody's asking, I love it, different questions and different areas. So after an embryo transfer, what's the advice on movement and exercise? So yeah, wonderful question. And I mean, I'll tell you my thoughts. I'll tell you, I think different doctors have different opinions on this. I actually don't know what Dr. Alexander says. Back in the day, we used to tell people, bed rest for a few days, right? So we say embryo transfer and then like go home and keep your feet up for a bunch of days. We actually know that that's not really the best advice. Actually, we think that a little bit of movement and a little bit of blood flow can actually be helpful. What I actually tell people is the day of the embryo transfer, take it easy. Like, go home, hang out in the living room. I usually say couch rest that day. Just kind of keep your feet up and relax, lay back. But then the next day, I actually encourage people to walk around. I don't actually have people do exercise, but walking around, maybe a walk around the block, is okay. But just kind of limit it as much as possible for those subsequent few days. And I will tell you that you should speak with your doctor, because your particular doctor may have some specific advice specifically for you. I don't know, Dr. Alexander, what
yeah,
do you say about
I
exercise
I
after
still
transfer?
kind of lean towards the 48 hours couch potato, just so that they're not exposed to all like the flu or COVID if they go out and about or go to work. But some people just that first day kind of couch potato and rest. I definitely say, walking, sit outside, like general rule of thumb is just like a normal life, but inside if possible, in terms of not driving to work or driving to a outdoor restaurant or something like that. But I think at the end of the day, the embryo has to find the receptors to attach. There has to be that kind of connection where the embryo binds and burrows in and sticks. So it's not necessarily anything we do. Some
Yeah.
people have no choice. They have to get to work the next night and
Mm-hmm.
they work the night shift. And I just say,
Yeah.
okay.
Yeah, I mean, I
So
was
I think,
doing embryo transfers on other people the day after my embryo transfer. I mean, right, you're right. I mean, in the end, the embryo, if it's going to find its way in, it's going to find its way in. I usually say the fate is a lot of the fate I feel like is sealed once that embryo is frozen. It's either going to result in a pregnancy one day or not. We just do what we can. And I think also the important thing is you don't want to look back and say, oh, if only I did this, if only I do that. So I think that's part of why we give some of these kind of precautions.
yeah, well, it's so nice to be with you, Dr. Chafkin, and I
Oh, so nice
look
to be with
forward to
you.
our next IG Live. And if anyone thinks of other questions, we're happy to go over them. And I hope everybody has a wonderful, blessed rest of the day and hope to see you soon. Take care.
Great. Take care.